Hello friends, I'm glad you're here with us today. Today, let's talk about a remarkable therapy that's changing lives around the world, Constraint-Induced Movement Therapy, or CIMT. This innovative approach is making a real difference for people who have lost movement in an arm or leg. Imagine for a moment what it would feel like to suddenly lose the use of an arm or leg after a stroke or brain injury. Simple actions you once took for granted become incredibly difficult. Everyday tasks, like buttoning a shirt, eating, or writing, can become a daily struggle, affecting not just your independence, but your confidence and sense of self. For many years, people believed that this kind of loss was permanent and that recovery was out of reach. But CIMT offers new hope by helping the brain relearn how to use a weakened limb, even years after an injury. It's more than just exercise. It's a powerful way to retrain the brain itself, harnessing the brain's natural ability to adapt and change. CIMT has helped millions of people regain independence, from adults recovering after a stroke to children with cerebral palsy learning to use both hands for the first time. The secret behind CIMT? It targets the brain's tendency to ignore a weaker limb after injury, a phenomenon known as learned non-use. By focusing attention and effort on the affected side, CIMT encourages the brain to form new connections and pathways, making movement possible again. This process can restore abilities once thought lost, giving people back skills and confidence they feared were gone forever. In this chapter, we'll explore what CIMT is, how it works, and who it can help. Whether you're a patient, a caregiver, or a healthcare professional. You'll learn about the fascinating science behind brain plasticity, discover the different ways CIMT is practiced, and understand the challenges and rewards involved in this journey. Whether you're seeking hope for yourself or supporting someone you love, this is a story of possibility, resilience, and transformation. CIMT is a powerful tool to help people reclaim movement, rebuild confidence, and take back control of their lives. So let's begin this journey of understanding together. Let's dive in and discover the hope that CIMT can bring. So what exactly is CIMT, or Constraint-Induced Movement Therapy? Imagine your arms as a team. When one is weak or injured, the other naturally steps in to help, often taking over most tasks. Over time, this can lead the brain to almost forget about the weaker arm, causing it to be used even less. CIMT interrupts this pattern by gently restraining the stronger arm, often with a mitt or sling, so it can't take over. This approach forces you to use your weaker arm for daily activities, from brushing your teeth to eating or getting dressed. The constraint part stops you from relying on your stronger, more capable arm, making the weaker one do the work. The induced movement part is where the real therapy happens, through guided repetitive exercises that use only the weaker limb. These tasks might include picking up blocks, stacking rings, or even writing your name, repeating them many times to build skill and confidence. This intense focused practice sends powerful signals to the brain, waking up the areas that control movement and coordination. The brain, now forced to pay attention, starts to reorganize itself and find new ways to control the weaker limb, creating new neural pathways. CIMT is like a training camp for both your brain and your limb, pushing them to work together and improve. The combination of constraint and focused, repetitive practice is what makes CIMT so effective for recovery. It's not just about strengthening muscles, it's about retraining the brain to use the affected limb again. Over time, this leads to real, lasting improvements in movement, function, and independence in daily life. That's the power of CIMT, helping people regain abilities they thought were lost. It's a simple idea, but one with profound and life-changing results for many patients. Now let's see how this groundbreaking approach was discovered. On to the science. The story of CIMT, or Constraint-Induced Movement Therapy, begins with the pioneering work of Dr. Edward Taub. In the 1970s, Dr. Taub conducted groundbreaking research with monkeys to understand how the brain responds to injury. He observed that when monkeys lost sensation in one arm, they stopped using it, even though the arm could still move if they tried. This phenomenon, which he called learned non-use, was not a permanent disability, but a behavioral adaptation. Dr. Taub began to wonder, if this non-use was learned, could it also be unlearned through the right intervention? By gently restraining the monkeys' stronger arms, he encouraged them to use their weaker ones, and remarkably, they regained much of their lost function. This experiment revealed something extraordinary. The brain could adapt, change, and relearn skills that seemed lost. The key to this process is neuroplasticity, the brain's remarkable ability to form new connections and reroute signals after injury or trauma. CIMT harnesses this power by forcing the brain to focus on the weaker limb, stimulating recovery and growth. Through repetitive, focused practice, the brain gradually builds new neural pathways, allowing patients to regain movement and independence. The concept of learn non-use is reversed. The brain learns to use the affected limb again, step by step. Dr. Taub's discoveries revolutionized rehabilitation, showing that with the right approach, we can help the brain heal itself and restore lost abilities. Recovery isn't just about strengthening muscles. It's about retraining the brain to take control again. CIMT stands as a powerful example of how science and therapy can work together to unlock the brain's potential. Today, CIMT is used worldwide, and therapists tailor it to each patient's unique needs and abilities. There are different approaches to fit different needs, ensuring that therapy is as effective as possible for everyone. Let's compare classic and modified CIMT to see how each method can help patients on their road to recovery. The right approach can make all the difference. Here's how these innovative therapies are changing lives every day. CIMT comes in two main forms, classic and modified. Classic CIMT is intense. Patients wear a constraint on the strong arm for up to 90% of waking hours, with 6 hours of therapy daily for 2 to 3 weeks. It's like a full-time job, designed to push the brain to adapt quickly. But not everyone can handle this intensity. Modified CIMT, or MCIMT, is more flexible. Patients might wear the constraint for a few hours a day, with shorter therapy sessions spread over several weeks. This approach is easier to fit into daily life and less exhausting. Both methods aim for the same goal: improved function in the weaker limb. The choice depends on the patient's needs, stamina, and support system. Studies show both versions can be effective. The best approach is chosen together by patient, family, and therapy team. It's about finding the right fit for recovery. Now, who can benefit from CIMT? CIMT helps a wide range of people with movement challenges. It's most commonly used for adults after a stroke, helping them regain use of a weak arm or hand. It's also used for those with traumatic brain injury or multiple sclerosis. For children, CIMT is especially effective for cerebral palsy, particularly hemiplegic CP. It helps kids use their weaker hand for play and self-care. CIMT can also aid recovery after pediatric stroke or brachial plexus injury. The therapy can be adapted for both arms and legs, improving walking and balance as well. The key requirement? The person must have some movement in the affected limb to start. CIMT is versatile, but not for everyone. Let's look at its benefits and limitations. CIMT offers real, lasting improvements in movement and independence. Patients often regain strength, coordination, and confidence in a limb they'd nearly given up on. These gains can last for years, improving daily life and self-esteem. But CIMT is hard work. It requires motivation, commitment, and support. The therapy can be tiring and sometimes frustrating, especially at first. Not everyone is a candidate. Some movement in the affected limb is needed. Severe cognitive issues or complete paralysis may rule out CIMT. The program's intensity and cost can also be barriers. Success depends on the right patient, the right timing, and a strong support system. Despite challenges, CIMT can be life-changing. Now let's see how technology and play are making CIMT even better. The future of CIMT is exciting. Rehabilitation is evolving, and CIMT is embracing new technology. Robotics and virtual reality make therapy more engaging. Imagine using your weak arm to play VR games or control a robotic device. These tools provide instant feedback and track progress, making therapy more motivating. Functional electrical stimulation, FES, sends gentle electrical pulses to help muscles contract, allowing even those with little movement to participate. For children, play-based CIMT is key. Therapy sessions become games, building blocks, arts and crafts, or playful challenges with a magic mitt. This playful approach boosts cooperation and makes therapy fun. Technology and creativity are expanding CIMT's reach and effectiveness. Whether for adults or kids, these innovations make recovery more accessible and enjoyable. The future of CIMT is bright. Now, let's look at what a CIMT session actually involves. Here's what therapy looks like. What happens in a CIMT session? Activities are tailored to each person's needs. For adults, tasks might include picking up objects, turning pages, using utensils, or buttoning shirts repeatedly to build skill. Personal care and household tasks like brushing teeth or folding towels, are common. Each small success strengthens the brain's new connections. For children, therapy is playtime, popping bubbles, building with blocks, finger painting, or playing with putty. The therapist shapes activities to be challenging but achievable, celebrating every effort. The goal? Make the weaker limb useful in daily life. Repetition and encouragement are key. Every session is a step toward independence. CIMT is about turning effort into ability. Now let's wrap up with a message of hope. Here's what CIMT means for reclaiming your life. CIMT is more than therapy. It's a philosophy of recovery. It teaches us not to give up on a weak limb, but to challenge and retrain it. For patients and families, CIMT offers hope. Recovery is possible, even after serious injury. Progress takes time and effort, but the results can be transformative. Talk to your doctors and therapists about whether CIMT is right for you. For therapists, your creativity and encouragement are vital. Embrace new techniques and technology. For children, make therapy play. CIMT shows the power of focused practice and the brain's ability to adapt. With the right support and determination, independence can be regained. Let's use this knowledge to bring hope and healing to more people. Thank you for joining this journey. Recovery is possible, one step, one movement at a time. Stay hopeful and keep moving forward. Please do subscribe for more updates and do like, share the videos to your family and friends who are in need of. Thank you all.